जिस बात का डर था वही हुआ. लिम्फोसार्कोमा ऑफ द इंटेस्टाइन. जिस बात का डर था वही हुआ. लिम्फोसार्कोमा ऑफ द इंटेस्टाइन.
If you do not want to sound like this, then you have come to the right place. Hello everyone. Welcome back to the Organon classroom with Dr. Ghazala. Here we are with episode 3 of Hughes series Lecture for Knowledge of Disease. Today it's going to be quite an interesting lecture. Why? Because here Hughes himself has asked us an important question that everyone wants to talk about the cure. But do you really know what you are trying to cure? So let's explore what he wanted every physician to know before reaching out for the correct remedy. Let's get started with the lecture for today. In our special topic lecture, we have very properly understood the true expression of the Hahnemannian law. Okay, it was currenter versus curanter debate, है ना? तो उसमें हम लोगों ने बहुत अच्छे से समझ लिया है कि Hahnemannian law का basis क्या है, which is similia similibus curenter, let likes be treated by likes, right? Ab, we are going to compare this principle with another principle which has existed in medicine for the longest time, for centuries now actually, and that is contraria contraris curenter. Let opposites be treated by opposites, right? एक नजर में देखेंगे तो both the approaches they seem logical. क्यों? क्योंकि if someone has pain you give a painkiller, if someone has sleeplessness you give a sedative, if there's constipation you give a purgative, right? Simple and logical. And that is exactly the principle of opposites. It aims to suppress or give a transient relief to the complaint. Hahnemann, however, proposed that something fundamentally different is present here. What? That he believed that if he wants to cure, the cure will have to be mild, the cure will have to be rapid, and the cure will have to be permanent. We must select a medicine capable of producing symptoms similar to those of the disease. This is the law of similars established in aphorisms 5 and 6 of the 4th and 5th editions of the Organon. So the real difference is this. One method seeks temporary relief. Now, which is that one method for the temporary relief? Contraria contraris. And the other seeks a lasting cure by addressing the disease according to the fixed curative principles, and that is similia similibus. So far, we've compared two great therapeutic philosophies, right? But Hughes is reminding us over here that medicine is broader than this debate. There are situations when neither your similars nor your opposite is going to be even considered. वहां पे you have to simply remove the cause. Okay, understanding what cures disease is only one part of the medicine, guys. Equally important is recognizing when this disease is persisting because the cause, the maintainer, has not been removed yet. So Hughes here is now shifting our attention from the bhari bhadkam laws to a therapeutic principle. Okay, and that is quite an understanding and a simpler one, which is tole causum, or remove the cause. Okay, so now as you can see on our slides we've got these four parts. तो हम लोग ये four aspects में देखेंगे कि cause निकालने से कैसे the disease is going to be better, the patient is going to be better. All right, so first let's see, if there's a person, if there's a patient who's got scurvy. ठीक है, अब सब को पता है कि स्कर्वी क्यों होगा, डेफिशिएंसी ऑफ एस्कॉर्बिक एसिड विटामिन सी, है ना? तो सर्वी अगर डेवलप हो रहा है बिकॉज ऑफ दिस न्यूट्रिशनल डेफिशिएंसी, करेक्टिंग द डाइट बिकम्स द ट्रीटमेंट. इफ एक्सेसिव टी, कॉफी, टोबैको, अल्कोहल जैसे टॉक्सिन्स होते हैं, ये ओवर स्टिमुलेंट्स होते हैं, उसकी वजह से उसको अब्यूज कहला जाता है. व्हाई? बिकॉज यू आर एक्सप्लॉइटिंग इट, राइट? ये सारे मॉडर्न पॉइजन्स, ह्यूजेस इज कॉलिंग इट एज मॉडर्न पॉइजन्स, दे डिस्टर्ब द सिस्टम. तो इसकी वजह से अगर बॉडी की नॉर्मल फंक्शनिंग इज गेटिंग अफेक्टेड, सो व्हाट आर यू गोइंग टू डू? एब्सटेन फ्रॉम इट. वो लो ही मत. अगर आपको पता है कि आप कॉफी पी रहे हो और आपको नींद नहीं आ रही है एंड यू आर कंप्लेनिंग ऑफ इनसोम्निया, तो ब्रो डोंट हैव द कॉफी, नो, डोंट हैव इट, स्किप इट ऑफ. यू ऑटोमेटिकली गोइंग टू गेट स्लीप. It is as simple as that. When you are removing the cause, now one may argue कि मैम ailments from हमारे तो ऐसे ही होते हैं when you are exploiting these stimulants and all of it. तो उसकी वजह सबसे अपनी famous remedy in the basic one नक्स vomica, उसका एलिमेंट फ्रॉम क्या है, जब ये सारी चीजें ज्यादा हो जाती है, सो वो क्यों हो रही है, उसकी वजह से द कंडीशंस आर डेवलपिंग टू अ लेवल, ऑलराइट। हम जब कॉफी, अल्कोहल, टोबैको, ये सारे ओवर स्टिमुलेंट्स, वी आर गोइंग टू स्टॉप इट, ओके, वी आर गोइंग टू टेल द पेशेंट टू नॉट टेक इट, तो उससे हम क्या कर रहे हैं, वी आर गोइंग टू रिमूव द कंटिन्यूइंग इरिटेशन, ऑलराइट, जो वाइटल फोर्स को वो जितना ओवर स्टिमुलेट कर रहा है और जिसकी वजह से द वाइटल फोर्स इज गेटिंग डीरेंज्ड, ठीक है, और डीरेंज हुआ मतलब यू आर गोइंग टू गेट द डिजीज सिम्टम्स एंड ऑल ऑफ इट टुगेदर, ऑलराइट। तो वो जो कंटिन्यूअस इरिटेशन है, टू स्टॉप दैट ऑफ, वी आर गोइंग टू टेल द पेशेंट टू स्टॉप। But if those substances have already produced a functional or dynamic disturbance, which they have, that is why the patient is coming to you, the patient will need a homeopathic remedy to restore the health. समझ में आई बात? Homeopathy does not see merely prescribe just because एक cause था and it was existing इसीलिए, it is prescribed because that cause has already disturbed the vital force, समझो ये बात को, ठीक है। ailments from इसीलिए होता है अपने materia medica में, to guide us, the exciting cause has been removed but its effects remains, ठीक है, तो जो इफेक्ट होता है ना वो समझने के लिए वी गॉट एलिमेंट्स फ्रॉम एन एमएम, ऑलराइट, और इसीलिए वो कॉन्सेप्ट आता है अपने होम्योपैथी में। बट ओवर हियर टोलेकॉजम बिकम्स इक्वली इंपॉर्टेंट बिकॉज विद दिस वी आर गोइंग टू रिमूव द फ्यूल, राइट। आग में हाथ डालोगे और साइड बाय साइड आग को एक्सटिंग्विश भी करना है, बट वो फायर में फ्यूल भी ऐड ही कर रहे हो अपने ही हाथों से, सो यू थिंक द फायर इज गोइंग टू गेट एक्सटिंग्विश्ड गाइस? It won't. So what tolecosm does, that is remove the cause, it is going to remove the fuel. Similia restores the our body engine well, right? So the removing the cause will prevent further damage and the remedy repairs the damage which is already done. All right, I hope अगर ये question आपके दिमाग में आया होगा तो I've answered it well. All right, now comes environmental exposure. Exposure to fresh air, sunlight, natural surroundings may restore health in appropriate cases, right? Like, but physical measures such as hydrotherapy, massage, exercise, or even electricity may help when indicated. अब ऐसा ह्यूजेस वाइज से हम लोग बोलते हैं ना, थोड़ा हवा पानी बदलने की जरूरत है। So what is that हवा पानी बदलना? हवा पानी बदलना is this environmental exposure. आज जिस हिसाब से हम लोग जिस environment में रह रहे हैं, we are surrounded by pollution everywhere. AQI has gone for a toss everywhere, everywhere, universally. Okay, some areas it is more dominant और उसकी वजह से there are a lot of troubles. तो वो हवा पानी बदलने के लिए what we advise the patient, आप कहीं बाहर घूम के आओ, थोड़ी क्लीन हवा ले लो, थोड़ा चेंज हो जाएगा। So what is that change? That change is that we are removing that continuous cause of polluted air around the patient. Okay, this is seen well in the Ferrer Neps system. ये भी एक ऐसे सिस्टम करके दिया हुआ है in Hughes, you write it as it is. Alright, nature कैसे influence करता है is what this system talks about. फिजिकल इंटरवेंशंस, मैकेनिकल एंड एक्सटर्नल फिजियोलॉजिकल, देखो अभी अपने लिए फिजियोथेरेपी जो सारी चीजें होती है ना एक्चुअली, अब इसमें फिजियोथेरेपी इलेक्ट्रिसिटी वगैरह का क्या मतलब है, जो हम फिजियोथेरेपी में क्या होता है इलेक्ट्रिसिटी से, इलेक्ट्रिसिटी मतलब हम लोग कुछ इलेक्ट्रिकल गैजेट्स कैजुअली यूज नहीं कर रहे हैं, राइट। अभी ह्यूजेस टाइम्स में ट्रीटमेंट बाय इलेक्ट्रिसिटी रेफर्ड टू द थेरापेटिक यूज ऑफ इलेक्ट्रिकल करंट्स टू स्टिमुलेट द नर्व्स एंड मसल्स, वो अभी भी यूज करते हैं हम लोग। टुडे वी नो दिस एज इलेक्ट्रोथेरेपी which forms an important part of physiotherapy, right? नर्व मसल स्टिमुलेशन हो गया, पेन रिलीफ के लिए जैसे ट्रांसक्यूटेनियस इलेक्ट्रिकल नर्व स्टिमुलेशन देते हैं वो होता है, आईएफटी करके होता है फॉर पेन एंड इन्फ्लेमेशन। तो भी ये है ना, we notice that these methods they do not act according to the law of similars, they work through physical and physiological mechanisms, therefore Hughes is classifying them as physical interventions rather than homeopathic therapeutics. Okay, this is going to stimulate your vital force to an extent that it starts showing up symptoms or set of symptoms properly. और जब अपने को एक set of symptoms मिलता है, जब अपने को portrait of disease मिलती है, only then we are able to cure. ठीक है, तो इसीलिए जरूरी होता है to remove the cause. So far, Richard Hughes has shown us how a physician may treat disease, right? Whether it's by law of similars, by opposites, or by removing the cause. But before discussing methods of treatment, Hughes now asks us to step back and answer an even more fundamental question. What exactly is disease? Because unless we understand what disease is, how can we ever claim to treat it? The diagram right in front of you illustrates Hughes' answer. Think of disease as having two aspects. Okay, you can see the funnel right in front of you. So the upper one and the lower one. All right, so the upper broader part of this funnel is representing noumena. All right, the hidden. Okay, and the lower part is representing the phenomena, that is the observable. All right, अभी जो ऊपर वाला the hidden, the invisible part है, we know that something within the patient has gone wrong, but we cannot directly see it, touch or measure the disease itself. It remains hidden. नीचे वाला part है the phenomena, right, the observable. ये एक नैरो ओपनिंग है जैसे कि आपको दिख रहा है, and everything the hidden disease reveals to us, the patient's symptoms, signs, sensation, behavior, physical findings, all observable changes. In other words, the totality of symptoms. अब इसी फनल को आप ऐसे उल्टा इमेजिन करो, ठीक है, अपसाइड डाउन. आपको नहीं लगता जो हम टिप ऑफ द आइसबर्ग और ये सारी चीजें बात करते हैं, इट्स द सेम थिंग दैट वी हैव अर्लियर स्पोकन अबाउट, राइट? Something that can be seen and something that keeps hidden. और ये जो hidden part होता है ये अपना latent miasms और वगैरह में जाता है, that we had earlier discussed. ठीक है, now coming back to this, we are going to notice something important over here. As physicians, we cannot reach the disease directly, right? The only doorway through which the hidden disease becomes visible is through its phenomena. All right, the objective symptoms, the only doorway, only part from where we can know that the person is not doing well is through the symptoms. This is why Hahnemann repeatedly insisted that the totality of symptoms is the only guide to cure. We don't prescribe for an invisible disease. We prescribe for the way that invisible disease expresses itself in the patient. इसीलिए हमेशा हम लोग प्रेजेंटिंग टोटलिटी लेते हैं, प्रेजेंटिंग टोटलिटी ऑफ दैट पेशेंट. उसके बेसिस पे ही द मेडिसिन और द सिमिलियम इज गिवन. उसके आगे जाके हाउ एंड व्हेन द वाइटल फोर्स इज रिएक्टिव, नॉन रिएक्टिव और जो सारे उसके रिएक्शंस रहेंगे कम्स इनटू पिक्चर, एंड देन अकॉर्डिंगली वी स्टार्ट ट्रीटिंग द पेशेंट वेल. ऑल राइट, Hughes beautifully summarizes now this idea in the quotation below. He says that the invisible morbid alteration within the patient and the perceptible changes that appear before our senses together constitute what we call as disease. The hidden aspect may exist philosophically, but for the physician, it is the observable phenomena that have practical importance. Okay, omnipotence, what we term disease. Omni matlab everywhere. All right, so the message is simple yet profound. The essence of disease may remain hidden, but the language is its symptoms. And it is that language, guys, that every good physician must learn to read and understand. Now that we know where disease reveals itself, the next question is even more interesting. What exactly are things, these phenomena, and why did Hahnemann call them the only thing that the physician can truly know? Let's explore that next. In the previous slide, we learned that disease reveals itself through its phenomena, the symptoms. Hughes now takes that idea one step further by comparing pathology with symptomatology. Pathology studies the structural changes produced by the disease, the damage that has already occurred in the tissues and organs, right? Structural hota hai wo. In other words, it tells us what disease has done to the body. the structural changes that the disease has done to the body rather. And symptomatology on the other hand, dynamic. How? Because studies the functional disturbances, the earliest changes experienced by the patient often before any structural damage becomes visible. This gives the physician an opportunity to intervene much earlier. The example on the left, okay, it explains to us this concept. Imagine a leaking ship. If we only keep pumping out the water without repairing the leak, we are treating the consequence and not the cause of the disease. Similarly, pathology often identifies the end result of a disease, whereas symptomatology helps us to recognize the disturbance before the permanent damage sets in. Okay? As Carol Dunham rightly said, pathology knows the products of disease. It does not know the disease itself. And for the homeopathic physician, symptoms are not merely complaints, they are the earliest language through which the disease is talking. All right? इसीलिए जब हम symptomatology पढ़ते हैं तो उसमें we give a lot of importance towards the subjective and the objective side of it. Okay, subjective is what the patient is feeling, objective are the signs that we see in that patient, and the signs are usually of the disease. ठीक है, जो सारे अपन मेडिसिन में पढ़ते हैं ना, गोल्ड स्टैंडर्ड ट्रायल्स वगैरह, ये वो, दैट इज ऑल एग्जैक्टली व्हाट यू आर गोइंग टू सी, बट देन उसको आइडेंटिफाई करने के लिए भी आपको मेडिसिन आना जरूरी है, right? Unless you know your medicine, you're just taking those as some fancy symptoms and you think कि नहीं इसको तो repertorize करेंगे, we've got an amazing rubric, we've got amazing this, amazing that, but by the time you are starting your treatment, the patient is already deteriorated because the course of that disease is not going to stop for you to take your case, to analyze it, to repertorize it, and then go towards the final remedy. All right, that is why it is important. I've been telling you from the first lecture itself, it is very important to know your medicine well. All right, the concept of the medicine, the course of the disease. Okay, नहीं तो patient आएगा आपके पास for fever and you are treating him, he thirst at short intervals in sips, ये एक symptom लेके आप सिर्फ बैठोगे and you are going to rule out everything else that the patient is suffering from. ठीक है, no doubt we have specific symptoms which guide you towards specific remedies, but एक set of remedy होता है जिसको हम देखते हैं guys. Okay, we don't give one single कि बस ये इसका ये एक symptom basis पे कभी we never prescribe, we should never prescribe classically and technically. Okay, so always keep in mind that whenever you are taking the case, okay, tactful case taking, अभी तक जिन्होंने मेरा लेक्चर सुना होगा, all of it continues together, they know how important tactful case taking is. All right, that's smart case taking. You come to know what the patient is suffering from, the clinical diagnosis of it. और clinical diagnosis कौन सी चीजों से बनेगा? Subjective and objective symptoms together. The previous slide taught us that pathology observes the end product of disease, right? This slide explains why Hughes tells us that structural changes are not the disease itself, they are merely its effects. The real disease begins as a dynamic disturbance, as an invisible alteration in the living organism. Okay, convinced? This is the primary condition that governs and influences the body's function long before any tissue damage appears. If this disturbance continues unchecked, it eventually produces visible structural changes, what pathology calls pathological anatomy. These changes are therefore secondary and not primary. They are the consequences of the disease and not the disease itself. Think of it like a tree. If the roots become diseased, the leaves will eventually turn yellow and fall. The damaged leaves are visible, but the real problem lies hidden in the roots. Simply treating the leaves will never restore the tree unless the root problem is addressed. That is exactly what Hughes is emphasizing here. The dynamic condition is the cause, structural alteration is the effect. As physicians, our goal is to recognize and treat that cause before irreversible structural damage occurs. Okay, having understood what disease is, Hughes now attempts to classify diseases not merely by their names but by their phenomena, laws, and causes. He discusses three important groups. The first one is fevers, second one is inflammation, and third one is neurosis. The first one being fever, it includes synocle. Okay, now what is a synocle? It is an old medical word. Okay, we don't use it currently, but it means having or relating to sinoca. Sinoca is an old name again for continuous highly inflammatory fevers. All right, modern medicine may the doctors do not use this term today because it's obsolete. Modern medicine uses specific names, like sepsis, influenza instead. All right, so ye jo hai, it's an old word but it is related to continuous and high fevers. All right, next is you just notes that in this type of fevers with sinoca, typhus, intermittent, enteric, and relapsing fevers, right? The mechanism is it enters by the nervous system, because and here Hughes is noting up for us that these diseases primarily affect the nervous system, which is why remedies like belladonna and atropa often show a strong physiological relationship with the febrile states. Okay, now what is this atropa medicine? Do we know about it? It is atropinum over here, that we are talking about. It is derived from the belladonna alkaloids itself. All right, and it's a homeopathic remedy that we use, and it's often prescribed in highly diluted forms, obviously, and it has a close affinity towards neurological and eye related issues. ठीक है, opthal और neurological issues होते हैं, तो इसे हम ज़्यादा यूज करते हैं. But yeah, always prescribe on similimum. But this is what Hughes points us in this slide. Second part we are dealing with is inflammation, perhaps the most common one that we are dealing in our practice these days. अभी तो anti inflammatory diet भी आ गई. Anything that happens in the body, blame it on inflammation, right? So going ahead, they are recognized by four classical signs, as we all know: rubor, calor, tumor, and dolor, that is redness, heat, swelling, and pain. Although many inflammatory conditions eventually require pathology or surgery, Hughes reminds us that early functional disturbances can often be managed therapeutically before permanent structural damage occurs. Right? Third group, neurosis. Unlike the previous groups, these are classified according to the clinical manifestations, okay, rather than one single underlying cause. Conditions such as epilepsy, tetanus, hysteria, cholera are all included because they present a characteristic pattern of symptoms rather than a common pathology. ठीक है? The important point over here that Hughes is asking us to do is to look beyond the disease labels, okay, and understand the principles on which the diseases can be grouped and then managed. ठीक है, इसीलिए classification of the disease becomes very important. Okay, and one book that you can refer, foolproof for classification of diseases, for writing up your answers, understanding up in your clinic, or classifying it for therapeutic purposes, it is सरकार. All right, BK सरकार में बहुत अच्छे से over 2 pages they have given a tabular form for classification of disease. We'll take that in a separate lecture, but for now take a note of it and go up and read on how we label diseases homeopathically. All right, after discussing how diseases can be classified, Hughes is now showing us why this classification is clinically useful. All right, it helps the physician in two important ways: prognosis and the diagnosis. Let's begin with the prognosis part of it. First, prognosis in practice. This simply means predicting the likely course or the outcome of the disease. You just cites that the example of a typhus fever over here, okay, or a continued fever. A physician who understands the natural history of the disease knows that if the patient survives beyond the 14th or the 17th day, the chances of recovery becomes very high. This knowledge not only guides treatment but also reassures both physician and the patient's family. राइट, इसीलिए जब भी अपने पास फीवर का पेशेंट आता है अपन उसको पूछते हैं कि तुम्हारा बुखार का कौन सा दिन है वो. ओके, वी आस्क फॉर द डे ऑफ द फीवर. ऑलराइट, उसके बाद में ये ऑब्वियसली वी गॉट इन्वेस्टिगेशंस एंड ऑल दैट वी कैन डू टू rule out certain conditions and diagnosis. But when we ask a detailed history for that particular complaint, which is fever, it helps us a lot to understand the disease by itself. And once you know the disease, you know the course of it. Once you know the course of it, you know the prognosis of it. The second part that Hughes talks about is diagnosis. Here, Hughes reminds us that disease may look different on the surface but may arise from the same underlying cause. For example, conditions such as malarial neuralgia, diarrhea, cachexia may appear entirely unrelated, yet they all originate from the same poisonous influence. The lesson is simple over here, guys. A good physician doesn't look only at isolated symptoms, they search for the common thread that connects them. The better we understand the nature and behavior of disease, the more accurate our diagnosis becomes, and more confidently we can predict its cause. That is why Hughes is placing up so much emphasis on the knowledge of disease before the knowledge of remedies. All right. We've spent the last few slides understanding disease. Hughes now shifts our attention to the medicines themselves and introduces an interesting concept called as organopathy. Organopathy is based on the idea that certain remedies have a special affinity for particular organs. Okay, for example, Ceonathus americanus is well known for its action on the spleen, especially in conditions like splenic enlargement and pain. Such remedies are often called specific remedy because of the organ affinity. But Hughes also points out an important limitation. Simply choosing a remedy because it acts on a particular organ is not enough. The exact same thing that we told in our previous slide of the same lecture, that we do not support the use of specifics in our treatment, okay, quite frequently. Yes, if there's an acute patient coming up to us, all right, and uske symptoms are pointing out more than one, all right, एक symptom के basis पे आप एक remedy select नहीं कर सकते हो, okay. तो based on that set of symptoms, if there is one particular remedy coming and the symptom set is leading us to that remedy alone, then we may give that in acute conditions, ठीक है. But chronic में जब बात आ जाती है, you can't be continuing only on the basis of specifics. All right, our ultimate goal has to be the simillimum, that one remedy that is going to match the patient as a person, the patient as a whole, okay, and that is going to be through the totality of symptoms. एक बार आपका acute subside हो गया, ठीक है, the patient is in his almost equilibrium, ठीक है, तभी भी symptoms हो गए, but the patient is going to feel better if your medicine has acted well, okay. तब जाके जो आपको symptom set मिलेगा, that is going to help you to form the totality of that patient and the disease. All right, उसके basis पे हम देंगे that simillimum, and that will have to be the single simple remedy. All right, so organ affinity may guide us, but symptom similarity decides the prescription. In homeopathy we don't treat organs, ठीक है, we are going to treat that person जिसमें वो organ है. We treat that patient as a person, patient as a whole, and that is the difference between finding a specific remedy and finding a simillimum. Organopathy, guys, may point us in the right direction, all right, but the totality of the symptom is going to give us the right destination. Remember this, okay. Now we've got one of the best conceptual slides now in this lecture, because यहाँ पे I'm going to explain why homeopathy values subjective symptoms so highly. ठीक है, we've just seen that our aim is to find the simillimum, right, पिछली slide में, the remedy that matches the patient and not merely the diseased organ, okay. But where do we find that individuality? You just says that we find it in the patient's subjective symptoms. ये फर्स्ट सेकंड स्लाइड से हम लोग इस लेक्चर में सब्जेक्टिव ऑब्जेक्टिव सब्जेक्टिव ऑब्जेक्टिव बात करते आ रहे हैं, तो एग्जैक्टली exactly उसमें क्या फाइंड आउट करना है इज व्हाट वी आर गोइंग टू स्टडी हियर. एंड दिस इज आल्सो इम्पोर्टेंट फ्रॉम योर द नॉर्मल द जनरल सिम्टोमेटोलॉजी वाला जो आप आंसर लिखते हो, उसमें भी दिस इज इंक्लूसिव, ठीक है. तो डोंट मिस आउट ऑन दिस. Let's first understand the difference. Objective symptoms are those that the doctor can observe or measure. the doctor, the patient's relatives and the people around the patient and all, जैसे हम उसको usually define करते हैं, तो वो जैसे fever, blood pressure, swelling, laboratory findings or changes detected by examinations. तो ये हो गया signs. They are extremely important because they help us to identify the disease and assess its severity. Clinically हम क्या diagnose करने वाले हैं is based on the objective symptoms. All right. Hughes points out that conventional medicine has traditionally placed greater emphasis on objective findings, whereas homeopathy gives special importance to the subjective symptoms. अब subjective symptoms क्या है? They can only be experienced by the patient. These include pain, burning, heaviness, anxiety, fears, craving, sensation, emotions. जो हम पेशेंट एज अ पर्सन में लिखते हैं ना, फिजिकल जनरल्स जो होता है, जो वो सिर्फ उसी पेशेंट का होगा, इट्स नॉट गोइंग टू बी कॉमन विद एनी अदर पेशेंट, राइट? वो सारी चीजें दैट द पेशेंट इज फीलिंग फॉर हिमसेल्फ इज सब्जेक्टिव सिम्टम. दे कैनॉट बी वेड ऑन अ स्केल और मेजर्ड इन अ लेबोरेटरी. ठीक है, अगर पेशेंट इज टेलिंग यू कि उसे बहुत दर्द हो रहा है, तो उसे बहुत दर्द हो रहा है. ठीक है, नाउ हिज बहुत इज गोइंग टू बी डिफरेंट फ्रॉम योर बहुत. Get that straight. All right. If you know, we always end up making this mistake that, you know, we always ask the patient, okay, we want to measure the pain, and how will pain chart, pain scale वगैरह ये सारी, तो you know, there are things which is available. But when you are taking the case and especially in follow-ups, you ask how much percent better. Now is your 10% going to be same as patient's 10%? अगर same हो गया तो बस individuality ही निकल जाती है, right? तो we ask the patient कि आपको दर्द कितना हो रहा है on a scale of 1 to 10. If the patient will say 7, but is his 7 your 7? His 7 may be your 10. उसका पेन टॉलरेंस कुछ अलग होगा, आपका पेन टॉलरेंस अलग है, राइट? तो यहाँ पे जो हम देखते हैं वो सब्जेक्टिव सिम्टम देखते हैं. पेन चार्ट एंड पेन स्केल से इफ यू कैन analyze or assess that pain, okay, based on other findings as well, वो जो भी given condition होगी उसके basis पे you are doing it, it's a different story. ठीक है, फिर आप उसको objective symptoms में लेने वाले हो, you're taking up as a sign. All right, sign, sign. Okay. Subjective अगर होगा and the patient says मुझे बहुत ऐसे दबा दबा सा दर्द होता है, या ऐसे लग रहा है कि कुछ चुभ रहा है, ठीक है, बट देयर इज नथिंग एक्चुअली पियर्सिंग हिम अप कि उसे ऐसा लगे कि कुछ चुभे. ठीक है, बट दैट सेंसेशन दैट द पेशेंट इज कंप्लेनिंग ऑफ और mentioning about is the subjective symptom that we are talking about. All right. तो यहाँ पे स्पेशल इंपॉर्टेंस है अपना सब्जेक्टिव सिम्टम्स के लिए. ये लेबोरेटरी में मेजर नहीं होगा ऑब्वियसली. इमोशंस आप लेबोरेटरी में लैब इन्वेस्टिगेशन में नहीं दे सकते हो. इमोशंस आपके ब्लड वर्क में दिक्कत नहीं आएंगे, बट वो इमोशंस अगर सप्रेस हो गए तो उसकी वजह से जो सोमैटिक कंप्लेंट्स आएगी, ओके, इवेंचुअली फॉर्मिंग अप एज साइकोसोमैटिक डिसऑर्डर्स. ओके, जिसको हैंडमैन ने बहुत अच्छे से क्लासिफाई किया है इन 6th एडिशन. 210 to 230 में मेंटल डिजीजेस जिस हिसाब से कवर हुआ है वहां पे, इफ यू गो एंड स्टडी, ठीक है, ओवर अ पीरियड ऑफ टाइम व्हेन दिस इमोशंस प्ले अप इन द बॉडी, ठीक है, और फिर वहां से जो ट्रिगर होगा एंड देन मेंटल डिजीजेस कन्वर्ट इनटू फिजिकल डिजीजेस दैट forms a disease, and there will be a byproduct of the disease which you will be seeing up visibly. All right, इसीलिए case taking, tactful case taking is required, because we will elicit the ailments from of that case. Ailments from मिल गया, the causative modality, it makes the case much easier to solve it up and to repertorize. ठीक है, फिर अपनी जो set of remedies होती है वो narrow down हो जाती है, and once it is more narrowed you get the essence of that remedy, and you get the essence of that patient as well. ठीक है, उसका core क्या है, एक बार core of the patient मिल गया, cure in that remedy is 100%. Okay, take my word. So yes, Hughes is telling that we give in homeopathy a lot of importance, as we all know, to subjective symptoms than the objective symptoms. But conventional medicine, that is the modern medicine, and other counterparts, objective symptoms को ज़्यादा importance है than the subjective ones. Now we'll think of two patients. Okay, take an example with the same diagnosis of migraine. Okay, patient A, patient B. Now both of them are going to have the same pathology. But one patient, patient A, is telling you that he is feeling better in darkness. while the other says that he is feeling better with fresh air. One is quite irritable, A is irritable, and B is unusually quiet. If this subjective differences, this subjective difference will guide us towards the simillimum, ये और दो जो उसकी complaints होगी, ये ना उनका साथ में, this will be like an eliminating symptom, कि अगर दूसरी सारी सेट ऑफ सिम्टम्स की वजह से एक सिमिलर रेमेडी आ भी रही है, दो रेमेडीज आ रही है, ये जो एक पॉइंट है, ओके, यहाँ पे दो है दैट वी हैड, डार्कनेस वाला, फ्रेश एयर, इरिटेबल, अनयूजुअली क्वाइट, ठीक है, तो ये दो पॉइंट्स दे कैन बिकम आर एलिमिनेटिंग सिम्टम्स, और उसके ऊपर वी कैन कम टू अ सिमिलर रेमेडी, द मोस्ट सिमिलर वन, ठीक है. So the objective symptoms tell us what disease the patient has. Subjective symptom will tell us which patient has the disease. And in homeopathy, that distinction makes all the difference. Objective symptoms disease identify करेंगे, subjective symptoms individualize करेंगे. Okay. Abhi, on this slide, Hughes is telling us कि over a period of time from 1874 till 1900, ठीक है, ये पूरी टाइमलाइन में कैसे मेडिसिन, एनैट, ठीक है, ये सारी चीजों में जो people who used to work in these societies, okay, in these clinical societies or hospitals वगैरह, the medical school and all of it, तो इनके जो doctors रहे, इनके जो physicians रहे, how they have evolved, understood, and taken up the subjective symptoms, okay, and have limited the morbid anatomy. मतलब साइंस तो इम्पोर्टेंट थे ही, बट उन लोग ने सब्जेक्टिव सिम्टम्स को कहा, कौन से physician ने include किया है, is what Hughes is telling us in this slide. As you can see, this is straight away the names and the essays, or the writings that have been published. Okay, so Hughes ends this discussion with a powerful message. ठीक है, ये जो अपना lecture है आज जो हुआ, knowledge of disease, उसको Hughes, how he is ending in the book, that the importance of subjective symptom was not just a homeopathic claim. It gradually became a broader medical realization. To truly understand the disease, a physician must combine what can be seen with what can the patient feel alone. Good medicine begins with observation, guys, ठीक है, ये याद रखो, good medicine proper, but great medicine will begin with listening. ठीक है, यहाँ अपने को सुनना है, we have to listen to the sound of that disease, और वो disease का है, वो patient के अंदर है, so listen to your patients. ठीक है, any time patient, as soon as the patient is stepping up in your clinic, the case taking starts. समझ में आई बात, वहां से जो हमारा ऑब्जर्वेशन होता है, टिल द टाइम द पेशेंट लीव्स द चेयर एंड गोज आउट, फॉर यू, you get that time to prepare medicine, write your prescription and all of it, वो moment तक is the case taking. ठीक है, तो case taking is not simply what you are writing up on your paper. Case taking is everything. You're using your five senses very well together. समझ में आई बात. As we come to the end of this lecture, Hughes leaves us with one final thought. Medicine is both a science and an art. Okay, science helps us understand disease, while the art lies in applying that knowledge to heal an individual patient. Hughes reminds us that homeopathy is fundamentally a therapeutic method. It certainly appreciates contributions from pathology, physio, microbiome, and every other branch of medicine, but it does not depend on them to select a remedy. ये सारे अपने ना guiding forces है, okay, together, but जो totality or portrait eventually बनेगा, that should have the core of that patient. ठीक है, और ये सारे important है core की तरफ जाने के लिए. ठीक है, you need to unearth it, all of it together, तब जाके you will see what that patient is suffering from. Okay, its working basis is remarkably simple: the observable clinical picture presented by the patient. Whatever the hidden nature of disease may be, whatever its microscopic and pathological explanation, the homeopathic physician prescribes on the basis of what the patient expresses through the totality of symptoms, something that we just discussed. Okay, that is the meaning of Hughes' final statement. Homeopathy is a therapeutic method. Its instrument is the drug, its guide is the patient's symptom picture. Everything else helps us to understand disease better, but the prescription itself is ultimately defined or determined by symptom similarity. So the physician must certainly know pathology, guys. Okay, इसीलिए हम लोग पैथो पढ़ते हैं सेकेंड ईयर से. But while diagnosing the disease, he must never stop seeing the patient behind the disease. यही डिफरेंस होता है कन्वेंशनल मेडिसिन में और हम में. ठीक है, हम दोनों को यूनानिमसली देख रहे हैं फॉर द बेटरमेंट ऑफ द पेशेंट. हम सिर्फ एक ही चीज को, द बाय प्रोडक्ट ऑफ द डिजीज को ही डिजीज नहीं समझ रहे इन इट्स ओन एक्सटेंट. ठीक है, this is perhaps the greatest lesson Hughes is leaving us with. Okay, a diagnosis names the disease, a careful study of the symptoms reveals the patient, and it is this patient and not merely diagnosis that homeopathy is seeking to cure. All right, here we go with our exclusive handouts, specially made for you guys to understand the lecture at one glance. Today the lecture went a little longer, but it was important because this chapter is important for us. It forms the basis for the chapters that we are going to cover up later on. Okay, the next lecture is going to be about knowledge of medicines. Okay, and we'll try and make it as inclusive as possible. And if there's any comment, any query, or any suggestion, please DM me on Instagram or write down in the comments. I hope you enjoyed the lecture. Have fun, think well, study well. Happy learning to you all. Thank you so much.